Hello friends, my name is Hemlata Dhakulia. I am from group 4A. In this video, I am going to explain you about a drug named Physostigmine. So let's start. Physostigmine belong to the class choline esterase inhibitor, which helps us to treat the glaucoma. Physostigmine is a parasympathomimetic drug. Physostigmine is a parasympathetic cholinergic agonist drug. This drug is indirectly and reversibly acting cholinergic agonist. Okay, it is a tertiary amino. That's why it can cross blood-brain barrier. Physostigmine it's obtained by caliber bean and malchic tree. Moving forward to pharmacodynamics of physostigmine. Physostigmine is well absorbed in the body. It is widely distributed in the body and it is metabolized by the liver and it is eliminated by the urine. Moving forward to the main part of this video, that is pharmacodynamics of physostigmine. It is the main part because it tells about the mechanisms of action of the drug. There is an enzyme called as acetylcholine esterase. This enzyme causes a breakdown of acetylcholine. As a result, acetyl level decreases and the parasympathetic activity stop. Physostigmine drug comes and binds the enzyme acetylcholine and inhibits it and result into inhibition of breakdown of acetylcholine so that the level of acetylcholine in the body decreases and the parasympathetic activity starts. For example, this is our acetylcholine and it is the drug physostigmine. It will come and indirectly bind to acetylcholine esterase and it will block the action of this, and the action of acetylcholine esterase will decrease and the breakdown acetyl esterase can't break down the enzyme acetylcholine and the acetylcholine level will decrease and the parasympathetic activity starts. Okay, moving forward, the mechanism of action. It inhibits the acetylcholine esterase. It is responsible for the breakdown of acetylcholine, stimulates the nicotinic and muscarinic receptors and increases the acetylcholine at synapses. Moving forward, uses of physostigmine. Uses involves manage and treat antimuscarinic toxicity and glaucoma. It is tertiary amine, uh, reversible cholinergic medication, and it is also used as antidote for anticholinergic toxicity. Moving forward to contraindications of physostigmine, it is hypersensitive to the drugs, pulmonary diseases, gangrenes, diabetics, diabetes mellitus, cardiovascular diseases, gastrointestinal tracts obstructions, angle closure glaucoma, and neonates. In this video, I will show you some images related to it. This is the first image of parasympathetic mimetic activities that it's involved. It includes constrict pupils, it stimulates saliva, slow heartbeats, constrict airway, uh, stimulate activity of stomach, stimulates gallbladder, stimulates activities of intestines and contract bladder. Next, glaucoma. It increases outflow of the aqueous humor in the eyes. Next, the side effects of physostigmine. It includes nausea, vomiting, diarrhea, dizziness, headache, stomach pain, sweating, and dyspepsia. Overdose of these drugs can cause cholinergic crisis. Its metabolic and estrogenic may be neurotoxic that can occur rapidly following overdose. As a result, we should take this drug in limit. And that's all for this video. Thank you.
Hello friends, my name is Arti Eka from 4A group. In this video we are talking about one of the most important and widely used drug, paracetamol. Paracetamol, also known as acetaminophen. Paracetamol belong to the class analgesic and antipyretic drug. Let's discuss the uses of paracetamol. Uh, Paracetamol is a pain reliever and a fever reducer. Paracetamol it is used in a headache, cold, and fever. Paracetamol is often recommended as one of the first treatment for pain, as it's safe for most people to take and side effects are rare. Mm, sides Side effects of a paracetamol: first, uh, liver damage due to the overdose; second, feeling of vomiting; and third one, sometimes breathing problem. Paracetamol should start to work within an hour, and the effects usually last several hours. Because of its side effect, we can't use a paracetamol in children. A drug interaction is a reaction between two or more drugs, between a drug and food. Example, taking a nasal decongestion if you have any high BP may cause an unwanted reaction. Symptoms of overdose of paracetamol: first is a diarrhea, then second is a increase of sweating, loss of appetite, nausea, vomiting, stomach cramps, pain, and tenderness. That's all of paracetamol. Thank you.
Hello, myself Shanavi Sharke. I am from Group 4A. Today I am going to give the information about Methyls Pass. Here it is. Methyls Pass is a combination of two drugs like dicyclomine and mefenamic acid. Dicyclomine is an antispasmodic and mefenamic acid is an NSAID. NSAID means non-steroidal anti-inflammatory drug. Methyls Pass belongs from the class antispasmodic, anticholinergic, and antimuscarinic agent. Methyls Pass work under the mechanism of action as follows. Mefenamic acid blocks the enzyme action responsible for prostaglandin production. Prostaglandin is also responsible for pain, swelling, and inflammation. Mefenamic acid further binds with prostaglandin synthesis receptors like COX-1 and COX-2. COX-1 and COX-2 inhibits the action of prostaglandin synthesis. Second is dicyclomine. Dicyclomine acts on the smooth muscles of bile duct, uterus, intestine, aids in relieving the pain. This action is achieved via a dual mechanism just as follows. Specific anticholinergic effect of acetylcholine receptors. Acetylcholine receptors of two types. First one is muscarinic receptors and second is nicotinic receptors. Muscarinic receptors are further subtypes like M1, M2, M3, M4 and M5, and nicotinic receptors have subtypes like NN and NM. Therapeutic uses of Methyls Pass: it relieves cramps, nausea, bloating, and discomfort, stops the sudden muscle contraction, blocks the release of some chemical messengers which causing the pain and inflammation, Diagnostic uses of Methyls Pass. Prescription medication used to relieve the symptoms of menstrual pain and the cramps. It also used to relieve abdominal pain by reducing the spasm in the stomach and intestine muscles. Spasm is also known as contraction of muscles. These are the side effects of Methyls Pass, like dizziness, dryness in mouth, blurred vision, nausea. Nausea means vomiting like feeling. Sleepiness, weakness, and nervousness. Thank you.
Hello, myself Sheikh Mohammed Saif. Today I am going to explain you the drug called as Neostigmin. Now, Neostigmin is a drug which belong to the class choline. Let's talk about its mechanism of action. We know that between the two neurons there is a synapse where the acetylcholine is released. Now, acetylcholine is used as a neurotransmitter between the two neurons to transmit information. Now, to flush out this acetylcholine, we need an enzyme called as acetylcholine esterase, which break down acetylcholine into acetate and choline, and this choline is reuptaked by the neurons again, and which is reused. But here comes the role of neostigmin. The neostigmin inhibits the acetylcholine esterase, which leads increase in the amount of acetylcholine in the synaptic cleft, which this causes the overstimulation of the nicotinic receptors and muscarinic receptors. Now let's talk about its therapeutic use. Choline esterase inhibitor. It is used also as an choline esterase inhibitor. Symptomatic treatment of myasthenia gravis. It can be also used in cobra bite through an IV route. In post-operative paralytic iliacus and urinary retention, which in post-operative paralytic iliacus, it increases the motility of the peristalsis movement, and in the urine retention it relaxes the dextrose muscles. Now let's talk about its diagnostic use. It is used in the symptomatic treatment of myasthenia gravis. Now its side effects. In the side effects, we can find that there will be the patient will have a blur vision, chest pain, there will be less in the blood pressure, difficulty in breathing, and dizziness. Now let's talk about its adverse effect. Increase in acetylcholine leads to depolarizing backlog, which means that there will be, after increase in the acetylcholine in the synaptic curve, there will be it will take a long time to repolarize the neuron. Now let's talk about its contraindicators. Now it can't contraindicators, we can say the patient who can't be given neostigmin. They are persons who are suffering from hypothyroid gland, high tone of parasympathetic nervous system, coronary artery disease, sinus bradycardia, abnormal heart rhythm. Now let's about drug to drug interaction. It can't be given with atropine. Always remember that neostigmin should not be given with atropine. The patient who have been post operative, also it should be given with atropine also. Yes, we also need to give it with atropine neostigmin in myasthenic gravis patient. Now how we can say in the myasthenic gravis patient? In this patient, when we give neostigmin with atropine, actually what happens when neostigmin is given with the atropine, it reduces the over action of neostigmin on muscarinic and nicotinic receptors. nicotinic receptors, which to avoid overaction, or we can say overfire of the muscles. Thank you. That's it.